Chapter 24, Chronic Diseases. A chronic disease is one that tends to last a long period of time. So chronic diseases would be heart disease, high blood pressure, high cholesterol, things like that. They can include cancer and, again, heart disease. They're more common today because people live longer. So like we've talked about before, they didn't really know about these chronic diseases back in the day, and so people would die from these diseases and they didn't know why they were dying because they didn't know they had the diseases. So now that we're aware of these things, people are living longer. Chronic diseases are not always life-threatening, but can reduce the quality of life. Included in the cardiovascular disease, we look at hypertension, which is the high blood pressure, heart attack, stroke, and then treating the heart disease itself. Risk factors, we have modifiable and non-modifiable. So modifiable risk factors are things that we can, stop doing. Non-modifiable are things like heredity, age, gender. So looking at those modifiable risk factors would be smoking, inactivity, so not getting that physical exercise, high cholesterol, obesity and overweight, and then hypertension. Cancer, so factors contributing to cancer can be our diet. It can be occupational environmental factors, so things that we're around, infectious agents, again, obesity, inactivity, so again, not having that physical activity, and then genetics. Prevention and warning signs, know what to look for, try to prevent, so staying healthy, being active, those types of things. Practice caution. And then cancer treatments, there's chemotherapy, there is radiation therapy, there's lots of new different medications that people take by mouth, so pills that are treating cancers and things as well. Different warning signs that we need to kind of look out for is change in bowel or bladder habits, a sore that just doesn't heal, unusual bleeding or discharge, thickening or a lump in the breast or elsewhere. That's why it's really important to get into the habit of self-breast checks and self-testicle checks. Those are things that the doctors check for in the yearly examinations, so those physicals, but those are things that we can do as well to try to find a lump before it gets into those bad stages. Indigestion or problem swallowing, obvious change in a wart or a mole, and then a nagging cough or a persistent hoarseness. Some other chronic conditions, asthma, diabetes, migraine headaches, osteoporosis, those are all considered those chronic conditions as well. So in summary, many chronic diseases are going to be related to our lifestyle. So again, making those good habits now as you guys are younger are going to help you in the long run when you get into adulthood. Early detection and treatment is critical for effective treatment. So doing those checks, going and getting your regular physical checkups and things like that. We all know our bodies, so listening to our bodies. If something's going on, making that doctor's appointment and making sure that everything's okay. It's also important to know those symptoms and warning signs of the chronic conditions. Again, if we know those symptoms, we start seeing them, we see our doctor, and we can catch things in those early stages. And then habits started, again, during your teen years are going to influence the chances of chronic diseases into adult years. So that's why don't start smoking, eat healthy, exercise, those types of things.